Good afternoon. I am called Linda Kellen Ayvale, and I am going to take you through a review on the paper called A Vision Language Foundation Model for Precision Oncology. So, first of all, I'm going to give a brief description of what precision oncology is. So, precision oncology is a personalized approach to cancer treatment that tailors therapies based on an individual's genetic, molecular, and clinical profile. So it normally uses AI, genomics, and biomarker analysis to predict disease progressions and also to identify the most effective treatments. So precision oncology, as you get to see, it uses quite a lot of information to come up with a treatment or a conclusion on a cancer patient. So when they get the tumor, they have to check for the biomarker. They do biomarker analysis, they do genetic checkups, they do molecular checkups, then they check out on the clinical profile and all that. So this brings us to our introduction in that clinical decision making is very complicated and it involves information obtained from multiple data modalities, as you have seen in precision oncology. So foundation models represent a new frontier in medical AI research and development. These models are pre-trained on massive or diverse data sets and can be applied to numerous downstream tasks with minimal or no further training. So here we are looking at a foundation model that uses quite a lot of diverse data sets, and with it, it's able to give you predictions on numerous downstream tasks with minimal or no further training, which has not been happening in the traditional AI models. So the biggest problem that has been addressed in this paper is that integrating multimodal clinical data like pathology images, medical history, and text reports has been a very big challenge due to scarcity of well-annotated data sets. So here you find that traditional AI models struggle with unstructured and unpaired data, and this limits their ability to accurate diagnosis and treatment predictions. So this has been the problem that has been existing, in that for every prediction you have to make, you have to have only one kind of model that makes that. So there was need for a solution to effectively align vision and language modalities for improved clinical decision making. And that's where the multimodal transformer with unified masked modeling called MASK comes in. So this MASK integrates clinical data by learning from unpaired images and text using unified masked modeling. So here it also employs contrastive learning to align vision and language, so that it improves diagnosis, prognosis, and treatment prediction. So it has done this, and then it's able to eliminate the need for large labeled data sets, and then it enhances AI-driven precision oncology with minimal training. So MASK was majorly brought in order to see that it takes in the image information and the vision information all at once without need of labeled data. Okay. So the approaches that were used in the paper is, first of all, MASK is a multimodal transformer model which utilizes unified mask modeling. The model was pre-trained on 50 million pathology images and 1 billion pathology-related text tokens to align vision and language representations. Then it was also fine-tuned with 1 million paired pathology image text datasets for enhanced performance. Then The different deep learning aspects were MASC. It employs a transformer-based architecture with shared self-attention for vision and language processing. Then it also comprises of separate vision and language experts who process respective modalities efficiently. The learning paradigm used was self-supervised learning, where the model had to learn without explicit labels by reconstructing missing parts of input data. Then, during the pre-training, we used the paper talks about 2 stages. One of them was the unified masked pre-training, which used the masked image modeling and masked language modeling. Then we also, the paper also talks about the constructive pre-training, where here they aligned the image text pairs by pulling related representations closer and then push the unrelated representations apart. So the optimization tools were Adam W Optimizer, which was used to update model weights. I mean here, it updates model weights with weight decay of 0.05 to prevent overfitting. Then the other optimization technique used was cosine learning rate decay, which was applied to gradually reduce the learning rate after a peak of 1 times 10 to power -4 for stable convergence. Then during the contrastive learning, contrastive loss was used for better retrieval tasks. Then we also have the other optimization technique was cross entropy loss, which was used in masked pre-training in the MLM and the MIM to reconstruct the missing token. Then the downstream approaches or concepts in which this model was used is in the image to text and text to image retrieval, for which images were given to the model and it would give back text that prescribed that particular image. Then text was given to it and it would give you back an image that corresponds to the text given to it. Then in the visual question answering for pathology analysis, you would give it an image and then it gives you back an answer. Or you could ask it any question and then it gives you an answer, for which the question is in the image format. Then we have the cancer prognosis and treatment response prediction. So the results, it was applied on 6 different tests, for which there could be so many if I put them here. So I just summarized all of them, but it outperformed the PLIP, the model. The models that they were using to validate it or to test this was PLIP, BIAMD CLIP, Quilt1M, and Conch. So here it achieves accuracy, which is in between 3.5% to 16.2%. Higher performance across the various oncology tasks. Yes, so the paper describes all of them, but I just gave a range in which it operates in order not to have time. So this shows that MASC was really, really accurate compared to all the other top models that have been around. Yes, and in conclusion, MASC demonstrates strong multimodal AI capabilities for precision in oncology. And in the future, we will have to, the paper talks about expanding data sets and refining interpretability and integrating the model into clinical workflows. So the potential applications would include broader cancer types, and then like for it to be able to accommodate broader cancer types, and also to be able to do personalized treatment recommendations. Thank you so much.